Legacy Shiley versus Shiley flexible tubes. What's the difference and what does it mean for your patients? From the first tube in through the time the patient is discharged, Shiley flexible tubes incorporate several clinical enhancements designed for all stages of the care continuum. The clear flange was designed with enhanced wound care capabilities in mind. The new design allows for enhanced visualization of the underlying skin and stoma site. The recess on the backside of the flange and the additional air vents allow for reduced skin contact and better airflow around the stoma site. Shiley flexible tracheostomy tubes include increased safety with a taper-shaped cuff that uses lower intercuff pressures to provide a more effective air and fluid seal. Additionally, the cuff is thinner and less bulky, which requires less force to insert. When the cuff is deflated, patients may experience a significant increase in airflow around the outer cannula, which may reduce the work of breathing required to speak and wean. All of the models in the Shiley flexible tracheostomy line come standard with a tapered percutaneous tip. This feature aids in bedside insertion should it be preferred over a surgical procedure. The Shiley flexible flange features a built-in 15mm hub connector. This feature expands options for ventilating the patient without requiring an inner cannula to be in place. As a safety precaution, the inner cannula should always be in place when using a dual cannula tracheostomy tube. In the event of an occlusion, you can simply remove the inner cannula and clear the occlusion, rather than removing and replacing the whole device. The Shiley flexible inner cannulas snap into the integrated connector. The Shiley flexible tubes are manufactured with a soft material that uses a citrate-based, non-phthalate plasticizer. This change in material removes the DEHP chemical and allows for a softer feel than the legacy products. The outer cannula is flexible enough to conform to the patient's airway, but rigid enough to maintain airway patency.